Antihistamines by Tram and Giselle.
Histamine is an organic compound that is found in high concentrations in the lungs, skin, and the gastrointestinal tract. Histamine are stored in mast cells and are released during an allergic reaction. This can be caused by antigens, food, and some drugs. H1 receptors are found in the CNS and GIT. When activated, it causes vasodilation, contraction, and itching. H2 receptors are found in the stomach and increases secretion of gastric acid. H3 receptors are found in the CNS. When activated, affects locomotion, body weight, and temperature. H4 receptors are found in leukocytes and is involved in the immunity response. Antihistamines antagonize at H1 and H2 receptor sites that are responsible for immediate hypersensitivity reactions and gastric acid secretion, thus treating allergic responses and preventing redness, excessive tears, and vomiting. Antihistamines are reversible competitive antagonists that prevent histamine to bind to receptor sites. They usually block H1 receptor and can be found on nerve-ending smooth muscles and granular cells. However, some can block H2 receptors. Overall, blocking these receptors reduces the release of histamine and is used to treat allergen reactions.
Older generation antihistamines such as promethazine and tripolidine had various side effects, most of them being sedation in the form of drowsiness. Other side effects included decreased concentration, loss of alertness, lack of coordination, and impaired short-term memory. These severe side effects prompted the development of second-generation antihistamines with minimal effects on the central nervous system. Most lacked sedation, however they do include headaches, dry mouth, and feeling sick.
Antihistamine can also treat vomiting caused by motion sickness. This is done by blocking histamine receptors found on vestibular nuclei, which inhibits the chemoreceptors responsible for producing the effect of vomiting.
H1 receptor antagonists, also known as non-sedating antihistamines, do not cross the blood-brain barrier as they are substrates of the P-glycoprotein efflux transporters. These proteins inhibit absorption and pump out drugs before they can enter the central nervous system and thus prevent contact with the blood-brain barrier. Most first-generation antihistamines, which are available as over-the-counter medications, are inhibitors of CYP2D6 and may alter the metabolism of drugs dependent on it. These can include venlafaxine, tricyclic antidepressants, some antipsychotics, beta blockers, antiarrhythmics, and tramadol. Second-generation antihistamines that have a known potential for cardiotoxicity include tafenidine, esomeprazole, and avastin. Overdose in any of these drugs could lead to palpitations, syncope, or arrhythmias, all of which can be fatal. Tafenidine undergoes immediate complete first-pass hepatic biotransformation. It blocks potassium channels in cardiac tissue and is cardiotoxic. Hence, the result is fatal. Fexofenadine. It is not metabolized, and so more than 95% of it can be found in urine and feces after consumption. A single dose of standard St. John's wort increases concentration of fexofenadine while simultaneously reducing clearance of the drug, thus inhibiting intestinal P-glycoproteins. Loratadine. It is one of the most common antihistamines found to date. It could also be an inhibitor of P-glycoproteins, causing ATPase activity to increase above basal levels, and in turn inhibiting ATPase binding transporters. There's loratadine. It is an antihistamine that is 15 times more potent than loratadine at the H1 receptor site. Current studies have found no detrimental cardiac effects in patients who were administered high doses. However, more clinical trials need to be conducted to find other adverse effects for this antihistamine. In conclusion, future research needs to be conducted in this field to fully understand more potential interactions as well as more uses for antihistamines. Thank you for watching.
Created using Powtoon.